Welcome to Bamazaje Ganonindwa. This podcast is produced by the Communications Department at the Anishinaabeg Nation. We will be focusing on the issues and initiatives in Anishinaabeg Nation territory. I'm your host, Lisa Abel. This podcast is the last of a 4-part series exploring Two-Spirit-themed topics that we've created in collaboration with members of the Anishinaabeg Nation's Two-Spirit, Two-Heart Indigenous Queer Nation Advisory Council. In the first 3 episodes, we learned about Two-Spirit terminology, traditional roles and responsibilities of Two-Spirit people, and ways to address homophobia. In this 4th and last episode of this series, we'll hear part of the conversation I had with Nawaka Gishimigwan and Aaron Bowerman about Two-Spirit health. We had previously mentioned how homophobia can have serious impacts on a Two-Spirit person's physical, mental, emotional, and spiritual well-being, and accessing healthcare can be difficult if a provider isn't up to speed on 2S LGBTQIA+ health. Nawaka and Aaron will share the ways that health providers may make assumptions about Two-Spirit people, the challenges that trans and trans-identifying people may face when accessing gender-affirming care, as well as what it can be like to access health services in a rural or on-reserve community. There's a need for health practitioners who understand Two-Spirit experiences and realities. As always, services, programs, and awareness initiatives led by Two-Spirit people are key. Nawaka Gishimigwan, Longfeather, also known as Lyndon George, is a member of the Chippewas of Kettle and Stony Point First Nation. They live in Hamilton. Nawaka Gishimigwan identifies as Anishinaabe Ojokwe, one of many terms used by the Two-Spirit community. Nawaka Gishimigwan currently works in the justice field, and they've worked with Indigenous people all of their life, both on and off reserve. Aaron Bowerman was born and raised in Chagwinda First Nation on Manitoulin Island. Aaron identifies as an Anishinaabe Two-Spirit man. They have worked in the Greater Toronto Area for over 10 years, supporting various communities as a frontline harm reduction worker. Aaron is an Indigenous Research Associate with the City of Toronto. Is this connected to challenges Two-Spirit people may be experiencing when trying to access health services?
When we go into healthcare, people automatically make assumptions. And assumptions based on how we look, assumptions based on how we act, are assumptions based on what's around us in our environment. For instance, today, when I was working from home, I had to knock at the door, knock, 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 and it was a person coming to sell some products. They come into my home, and the first thing this young gentleman says, "Oh, what a beautiful home. You must have a wife." And I said, "Why would you think that it has to be a woman that decorates my home? Rather, what you should think is it's a queer that's decorating my home." But the same thing happens in healthcare. Assumptions are made. So there's gendering that happens. I may not. If I don't want to identify as male, they're going to automatically come in and they're going to say, "Mr. George, tell me what's happening today." That's part of the problem with healthcare. And it's not just that gendering by using that term Mr., but it's also, I talked to a friend of mine up north who is a language keeper, and I asked specifically about those titles, Mr. and Mrs. and Ms., and I think I talked about a little bit this yesterday. Those do not exist in our languages, and they don't exist because they're possessive in nature. But what does exist is descriptions of the relationship that people would have. So, for instance, the example he gave me is that rather than saying that you are Mr. or you is Ms. in a relationship, our language talks about your relationship with the person that you're with or that you're living with. It describes the relationship rather than putting any kind of ownership of your person to anybody else. And that's significantly different in our languages than it is from those prefixes that are given, those terms that are given to help announce who we are. That's just one of the problems. We do know that with trans identifying folks too, when it comes to access to many different things in healthcare, such as prosthetics for breast or prosthetics for penis. Those things are very difficult for them to access. We also know that for a very certain period of time that with our trans relatives, it was very complicated and difficult. And in some cases, Indigenous Service Canada did not want to change the name of an Indigenous person who was transitioning to their new identity, to the identity of which that they felt they were born, and that Indigenous Services Canada at some point were forcing our trans and trans identifying relatives to live with their dead names. And so that stuff all together creates access to health very complicated. Complicated in terms of trying to get access to hormones for our trans and trans relatives. Complicated in terms of accessing mental health services again. So all of those things get a little more complicated. And I can't help but to believe that 150%, most of that complication is caused from homophobia.
Yeah, and I think Indigenous people already have this not such a great history with healthcare systems, so it's, you're Indigenous plus you're queer and you're going in to see somebody and they have no idea what you're going through or understand who you are. I've had counselors in the past when I've talked about, my same-sex relationship, and they would keep catching themselves saying what, and maybe, well, your girlfriend, and then they would say like, oh, your girlfriend, and then they'd catch themselves and they'd be like, oh, your partner, and how am I supposed to sit there with someone, that doesn't understand where I'm coming from? And so I think it's really important that we have queer people in healthcare as well, and Indigenous people, um, because I don't feel comfortable sitting with someone who has no idea what I'm going through.
That's a really good point, Aaron, because it reminds me of the many times that I've gone into healthcare facilities, and you have to be completely honest with the doctor about your lived experiences as an Indigenous person and as a queer person. And trying to talk to somebody specifically, like let's say that the doctor is presenting themselves to be a heterosexual male, because when we come out to medical professionals, a couple things can happen. I've been on the tail end of those relationships, those health kind of relationships, those meetings where when I have let those healthcare professionals know that I'm queer, automatically there's an assumption that I'm living with HIV or that I have AIDS. That has happened far too long for any queer person, but it's happened for Indigenous people. And Aaron's talking about the history that of Indigenous people accessing healthcare, that there's so many assumptions made. So that intersectionality that happens with homophobia and queer folks having HIV and AIDS, and then you marry that with being Indigenous, and the assumptions made that we're dirty, unclean people, that does not create for a wonderful healthcare experience. And I think that I just feel that that's really important that Aaron had mentioned that history for us as Indigenous people, period.
Both of you mentioned the importance of having healthcare professionals who are two-spirit. Can you speak about that importance of health professionals, either them being two-spirit or other people who might be non-Indigenous having more awareness as well?
Yeah, I think having either queer or allied healthcare professionals is super important. It doesn't necessarily need to be that they're Indigenous or that they're queer or that they're two-spirit, but I think a non-Indigenous person could have a trans child, right? And they've put in a lot of work, I think, to figure out and learn, the different issues and understanding how complex that is and how hard it is to open up to a healthcare professional, to approach a healthcare professional, and not just doctors, but psychologists as well, psychotherapists. Yeah, I think it's super important, even when it comes to speaking to counselors about relationship issues. I think that's another one of those things that comes from, you know, broken families and homophobia. I think relationship issues are a huge thing in two-spirit communities. And, to be able to open up to somebody and have them understand what the issues are and, give that feedback that's actually going to help somebody is super important. There's very few healthcare professionals that identify as two-spirit. And when there are, I think they're overworked, right? Everyone wants and needs to speak to someone that can relate to them. And yeah, I think they're overworked and, it's a very, yeah.
And it must be just definitely hard to find them.
Mhm.
In your work, then, have you also noticed any differences in accessing healthcare for Two-Spirit Indigenous people in urban centers compared to on reserve or rural areas?
Yeah, definitely. I think, when it comes to on reserve, I think whether you're queer or not, I think it's a challenge to access health services because of lack of confidentiality. I could go into a health center and the homophobe might be the person that is doing my intake or might be the nurse, right? And so I think there's a huge challenge there. And what choice do you have? You don't. That's your health center. That's the one place where you should be able to access services without judgment and without worrying that someone is going to share the issues that I'm having, whether that's addictions or maybe I'm still in the closet and I'm talking to someone and they, how am I supposed to talk about my sexuality if nobody knows? And the one person that I'm going to tell is someone close to community, to everyone. There's such small spaces, but I do think, we're much more fortunate in urban settings. There are many queer healthcare professionals. There's becoming more Indigenous and queer healthcare professionals in urban settings. Thinking about these podcasts, for me, it's more talking about my personal, the things that are going on in my life. And when I think about things that are going on in my life, that is the issues, is relationship issues. So I think, as I've grown, sure, I've grown into my person and I've realized things that I didn't want in my life, but then also there's things that you can't help, when it comes to relationships. I've been in some very toxic relationships and a big part of my own doing as well, right? This is how I was taught. And then when those end, or you feel like the only way to help feel like you're happy or that you're not in pain is to lean on addictions, alcohol. You feel like you're having the best time of your life, you're forgetting your issues. And so I think for me, being two-spirit, that's one of the biggest pieces for me, and the biggest issue is, relationships and addictions, and our relationship to addictions. It's something that's very real in the two-spirit community, very real in the queer community, very real in the Indigenous community as well. And I think it's how we've dealt with our pain and our traumas, and yeah. I'm grateful that I was able to figure it out, and I'm in a very much better place. But it's hard when you don't have those positive relationships to teach you at a young age, and I think that's part of that homophobia. But we find the communities that hopefully are able to teach us how to be responsible, caring, loving human beings. And yeah.
Well, Miigwech, for sharing that, because we're trying to find ways to break cycles, right?
Mm.
Of what we've experienced growing up or in childhood, and especially as Indigenous people, there's lots of different things that might happen. But on top of that, that was an extra layer, then you're saying, of having to find your way to break these cycles as a two-spirit person as well.
Hmm. Hmm.
I'm glad to hear you feel you're in a better space now, a better
Yeah.
place. Yeah.
Yeah. Well, that's a thing too, right? I learned definitely how to be a better person in relationships, but then, you're working on one thing, and you figure out one thing, but then you have to work on another thing, so it's like I was able to start to learn how to be a responsible partner and a good partner. And now you have to figure out how to deal with your addiction issues, because sometimes we feel like substances will kind of take away some pain when you're going through things. And even if that you shouldn't be doing those things, you kind of do. And then you have to figure out how to navigate that, how to get out of addictions, right? And it's easier sometimes to just continue that path of addiction than to understand it and figure it out on your own, right? And that's, again, goes back to community. Like, that's why two-spirit people need community and really search it out. And luckily, you know, we are building more community. I've got some really great friends all over Canada who are super supportive. They all will always be there for me. They call me their sister, and and we build each other up whenever we can, and try to break that cycle of tearing each other down, and the crabs in the bucket kind of thing that I think we're all so familiar with. But luckily, I feel like the two-spirit community is starting to change, and we're definitely starting to build each other up and support each other, because we all know how hard being two-spirit and Indigenous can be, right?
I'm wondering, for young people who might be listening and are wanting to find these communities, how would you share the ways to seek out these kind of healthy, affirming communities?
Yeah. Well, I think, it's luckily we are in a world of social media. I think that's one way to connect with people. You may not find the people that are healthy in your community, but there are a lot of people across Canada and North America that I think are all there and willing to support each other. Also, sometimes you have to be that person. Sometimes you have to be the person in your community that's going to break that cycle and try to support other folks to be, healthy, happy, and part of community, right? Building up community sometimes means starting that community.
There are things that have happened certainly since I've been young. We never had cell phones. We didn't have internet when I was young. Those things have really changed the way that two-spirit Indigenous queer people are able to interact in our accessibility to information such as the history of two-spirit Indigenous queer, and two-hearted people. Those things have elevated our understanding of our roles and our responsibility and our places within community, so that now if somebody goes on to, if a young person is at home by themselves and they're feeling isolated, they could hop on their computer, on their tablet, their phone, and they can plug in Two-Spirit, and poof, there's all of these different resources that are afforded to them that make it easier for them to be able to talk about who they are. Not necessarily make it easier for them to come out the closet, because our communities still have a heavy shroud of homophobia over them, but at least provide them with an opportunity to begin to better understand their history as Indigenous, queer, Two-Spirit people, their roles, their responsibilities, and where they can find the love and the support that they need to be able to see the next day. That's what's really important, I think, in the change of our environment as Indigenous people, is the accessibility to that kind of information.
But also, I guess I'm just thinking that, there's a lot of people doing work. Teddy Surrett started a Two-Spirit group in Batchewana, and that's something that hasn't really been common. I could just imagine if I had the ability to participate in something like that in my community when I was younger, even if it was virtually, I think that would have made all the difference to my mental health. I think like thoughts of suicide wouldn't have been as prevalent. So I think that's also really emotional, is, these younger people that are, have the courage to start groups like this in their own community, even, in schools, the Gay Straight Alliance. Yes, they're not Indigenous specific, but to have that bravery and that ability and that push to want to do something like that to support each other is just, it's really inspirational, I think. And I just wish that that was more common in our communities.
So definitely that's part of the work that both of you would like to see in our First Nation communities.
For sure. As I said, I think it will help people in the future. There will be less mental health issues. There will be less suicide. There will be less addiction to substances. I think if we have that support and that encouragement to be the best people we could be, I think it'll help us and our communities as a whole in the long run.
I think I feel that the hope of healthier communities for me is within our young people, and that we're identifying that our young people have accessible to them technology that is opening up doors to them that may not have been opened up to them otherwise. And so that if we're not able to, for one reason or another, to see the same types of programs that are happening with Teddy Surrett in Batchewana, that at least there's afforded an opportunity for our young people in other communities to tap in virtually to what Teddy's doing in Batchewana. And I think that's really important too. But having something visible in our communities, it does mean something. When I go home and I see the pride flag hanging at our band office, that means something. It means that there's a visible identifier that Two-Spirit people are part of the community.
So we talked about how every community should have mandatory Two-Spirit education. So what do you think are the most important things that community members really need to learn?
Well, I think our seven grandfather teachings, and we always start with love. I think being caring and kind will go a long way. We just, Two-Spirit folks, youth, people in general just want to be loved. People want to know that they're a part of something bigger, and we talk about community all the time, but sometimes community isn't always healthy. And so I think being caring and kind, I think being inclusive, having fun, laughing with each other, we're a very humor focused people, and I think it's nice to have fun, to be healthy, and to enjoy each other's company. Yeah, I think just education on, I think Lyndon had said previously that the youth are the ones that are going to change the way that we see two-spirited people, and I strongly believe it as well. I think, like, if we start at a young age educating people, and it doesn't mean that they're not going to be homophobic, because they could learn that anywhere. They could learn it from their peers, they could be learning it at home. But I think if we're able to teach younger generations that we're all different, we're all the same, that some of us identify in different ways, we all have different upbringings, that I think people will just be more accepting. And I think, you know, they're gonna learn for themselves what's right and wrong. And I think, they're very influential, and they're gonna learn a lot of things from their peers. So if we are able to educate them together, that kindness and that love, and help them understand that it's okay to be who we all are, even if it's different, I think they're going to figure it out for themselves. And they're all, youth are really smart, and they're going to change the way two-spirit people are accepted. And that's going to have a lot of impact on everyone in our communities. Yeah.
Miigwech. I like that's a positive vision.
Yeah.
Yeah. Good vision of the future.
This podcast is the last of a 4-part series exploring two-spirit themed topics. In our first episode, we learned about two-spirit terminology within our Indigenous languages, as well as words that have been reclaimed through ceremony, such as two-hearted. In our second episode, we talked about the traditional roles and responsibilities that two-spirit people are reclaiming within our First Nations. In the third episode, Nawalka and Aaron shared how we can address homophobia by prioritizing inclusive language and policies, ensuring that two-spirit people are welcome in the community and at ceremonies, and by supporting two-hearted youth. And in this fourth episode, we talked about some of the challenges two-spirit people may experience when accessing health services, and why there's an important need for Indigenous healthcare practitioners, as well as services, programs, and awareness initiatives led by two-spirit people. Chi-miigwech to Aaron Bowerman and Nawalka Gishi-miigwech for taking part in this podcast series and for sharing your stories and valuable insights. The Anishinaabeg Nation formed a two-spirit, two-heart Indigenous Queer Nation Advisory Council in 2023 with the goal of bringing 2S LGBTQIA+ voices to the political forefront. If you or someone you know is interested in supporting this important work, please contact the Anishinaabeg Nation Special Projects Coordinator. Find the link in the podcast description. This episode includes the tracks Brothers by Wolf Saga and Chippewa Travelers, and Where the Road Meets the Sky by Justin DeLorme, licensed by Nagamo Publishing. Chi-miigwech for listening to this episode of B'madzaji Ginonindwa. Until next time, Bama Pi.